Hello, I'm Anton,
My name is Franz.
and on behalf of Zorwar, who's not here today, we're going to introduce to you rabies. Now, what is rabies? Rabies is a preventable and viral disease primarily caused by the rabies virus, causing sudden and severe encephalitis, aka inflammation of the brain. Around 59,000 people actually die from rabies every year globally, and, and rabies is common in rural parts of Asia and Africa, although technically it can be found everywhere. In terms of transmission, it is a zoonotic disease, meaning that the infectious agent, in this case the virus, can jump from an animal to a human. Rabies is commonly transmitted by infected animals such as dogs, of which constitute 99% of sources globally. The virus is spread primarily by direct contact with saliva from an infected animal, usually from a bite, scratch, or less frequently, contact towards broken skin, eyes, mouth, or nose. Risk factors: being in close contact with vaccinated wildlife, traveling in remote areas such as caves where bats are usually found, and working with close proximity to the animals or the virus itself, such as laboratory or vets, are considered to be very high risk factors for getting rabies. Once bitten by an infected animal, the virus enters the peripheral nervous system, slowly making its way to the brain and spinal cord. The virus can often spend multiple days to even weeks before it reaches the nervous system. During this time, the host is asymptomatic, meaning the host will feel no symptoms yet. As it travels along nerve cells, it causes nerve damage. The period where the actual signs and symptoms become present is when it actually makes contact with the nervous system. From there, inflammation of the brain rapidly occurs, and at that point, coma and death inevitably happen.
So, signs and symptoms of rabies. The symptoms typically appear within 3 to 8 weeks, but they can develop in as little as a few days or as long as several months. So, how quickly rabies symptoms appear depends on the location and severity of the wound, as well as the amount of virus transmitted by the animal. Rabies infection begins when the virus enters the body and infects nerve cells. So, what are the signs of rabies? There are tinglings, pain or itching at the bite area, headache, fever, anxiety, difficulty of swallowing, fear of water or hydrophobia, and some symptoms are hallucinations, excessive salivation, fear brought on by attempts to drink fluid because of difficulty swallowing water, seizures, partial paralysis. Diagnosis of rabies. Diagnosing rabies is difficult since no single test can detect right after exposure. Doctors must use several lab tests and monitor the animal involved in humans. A definitive diagnosis is often possible after clinical symptoms appear. Before symptoms of rabies appear, there are no World Health Organization approved diagnostic tools for identifying rabies infection before symptoms appear. After symptoms appear, saliva can be tested by reverse transcription polymerase chain reaction to detect virus genetic material. Skin can be tested. A small sample from the nape of the neck is tested by viral antigen, and also serum and cerebrospinal fluid are tested for rabies-specific antibodies.
Hello guys, I'm Zoravar and I'm gonna be explaining the treatments available for rabies. First, I'll be explaining the post-exposure treatments. So, the treatment must begin before the symptoms start to appear. The first step in this is to wash the bite with soap and clean water to address the wound. Then, doctors usually provide a series of rabies shots that are given over several visits. Now, if you're not pre-vaccinated, the doses are 4, but if you have been pre-vaccinated, the number of doses is only 2. This is done to help the immune system to stop the virus from spreading. If you're not pre-vaccinated or in severe cases, rabies immunoglobulin is also administered on the first day of dose. Getting properly vaccinated can completely prevent rabies. So treatments available. This is the treatment after symptoms start to appear. So once the symptoms start to appear, basically there is no effective cure possible, and there is supportive care in hospitals to help the patients breathe and controlling the pain with the symptoms onset. Prognosis. Now it takes several months or days for the symptoms to appear, but once the symptoms start to do, it is almost 100% fatal, and the demise usually occurs between 7 to 14 days. However, prevention with post-exposure vaccine before symptoms is the key to recovery. And that is all. Thank you and take care.